Lung cancer is a complex disease influenced by a combination of genetic, environmental, and lifestyle factors. Time to understand the leading causes and risk factors associated with the same.
Number one cause is lung cancer is tobacco smoking. Number two cause also tobacco smoking. Number three cause also tobacco smoking. So it's a very common cause for lung cancer. About 90% of lung cancers are caused by cigarette smoking. The second factor would be passive smoking. If a person smokes and his spouse is nearby and living with a person, then that person also likely to develop lung cancer. This we call it second smoking or passive smoking. That is the second most important factor. That's how many women in India develop lung cancer because of the passive smoking. Third factor is environmental and atmospheric pollution. In cities, people living in cities are exposed to a polluted air, which is caused by industrial pollution as well as automobile pollution. So these are the three main factors.
Secondhand smoke, also known as passive smoke, exerts detrimental effects on non-smokers who involuntarily inhale tobacco smoke. Pervasive in homes, workplaces, and public spaces, secondhand smoke poses serious health risks to those exposed, and non-smokers subject to secondhand smoke may experience an elevated risk of respiratory issues too.
Smoking cigarette contains more than 40 chemicals that are carcinogenic, that is present in the nicotine. So they are continuously exposed to the carcinogenic gases, and that's how they develop this. So it's very important that a person should not smoke in the house in a closed room, and that's how in offices also, in many places, people are now avoiding smoking inside the offices and theaters and other closed areas.
While smoking remains the primary cause of lung cancer, so can genetic factors play a role in influencing the risk of developing lung cancer?
It is not a very important factor, but about 10% of the people have some familial background of lung cancer. There are some factors. If a person develops lung cancer, he is likely to have a genetic predisposition to develop lung cancer, like P53, same thing, TP53 and KRAS. These are mutations that are associated with production of lung cancer. And if a person has this type of mutation, then the members in the family, other members in the family can also have this genetic predisposition. Similarly, they can have EGFR mutation, ALK mutation, RET mutation, MET mutation, and so many other mutations which are found in a particular person are likely to be present in other members of the family. So there is some amount of genetic predisposition to develop lung cancer in a particular family.
While various factors contribute to the complexity of lung cancer, tobacco smoke stands resolutely as the leading cause of this devastating disease. The overwhelming evidence linking cigarette smoking to lung cancer underscores the urgency of tobacco control initiatives too.